I'm going to let Christy take over. Christy, if you want to take the reins, and everyone, if you can stay muted, unmute if you have a question.
Thank you, Tree, very much. Hi, you guys. For those of you that have not been on my trainings before, my name is Christy. I am the Director of Clinical Practices here at CareFitient, and hospice is my expertise over home health, we'll say. I'm the one who makes sure that your documentation notes and all the clinical pieces of CareFitient follow regulation, and to put pieces in there to help you follow regulation. Because as you guys know, sometimes CMS gets a little crazy and we have regulation out there that is just too much for everybody to remember. So if I can put something in there to flag you, or just for you to click a box to make it easier to cover that reg, we're gonna do that. So today we're going to be doing the day one of the RN training. Again, some of you went through the RN training last week, so this will be a repeat for you. I do know from experience as a nurse educator that most of us are hands-on learners. So Tree is absolutely correct in that if you can get your hands in there and start practicing on your practice patients, it will make much more sense. It is a very intense system in that everything is connected for you, so you don't have to do things the same thing multiple times. So eventually you will really like it, I promise you that. For those of you that have not got in the system before, you are able to put CareFitient on your tablet or computer or phone or whatever device that you're going to use. You can put the URL on there. So that you just have what looks like an app, although it's not really an app, to click on, and it'll open this screen up. You will receive your org code, if you haven't already, which is LMVH3106. You'll receive a username, and you'll receive a temporary password. Once you put that in, the system is going to prompt you to change your password to something that you know. If after you've done that, you try to get in the system, or it could even be months down the road, and it's telling you you have the wrong password or you have the wrong username, please reach out to your leadership team or whoever they have directed you to change your password for you or to help you change your password. If you would call us, we are unable to assist you with that because of HIPAA. So there's no way for us to tell who you are, to verify who you are. So just know I just didn't want you to waste a call calling us. That's the one thing that we can't help you with. Anything else you can call us for. So once you've changed your password and you sign into the system, you're signing into what is called your home screen. So regardless of your discipline, everybody comes into the home screen. Now, what everyone has on top as far as tabs will be different based on your discipline. So this is what your guys' will look like. So there'll be a few things under each tab. You have your home tab. Anytime you want to get to your calendar, which is right here, you want to click on your home tab. Under your resources tab, you have associates. This will take you to your associate file. There may be in the future things in your associate file that your leadership would like you to do. Maybe sign your annual HIPAA form or update your compliance, something like that. The next tab is our patients tab. Today we're going to focus on just the patient encounters. And then these other tabs we'll talk about at another time. We go down a little bit further. On the left-hand side, this top piece called announcements, anytime that CareFitient has an announcement that they need you to know, it will be here. So for instance, if we're doing an update, we always do our updates in the middle of the night. So most of the time they don't affect you. Yes, we do know, because I've ran a hospice agency and been a hospice nurse, that many times you guys are out in the middle of the night. It does not shut down your system like some other systems do, so you can continue to work even though we're doing that enhancement, but you may see some changes. Your agency can also leave you announcements there. On down here, for a little further down, I don't really want to talk about these next two yet. We'll get to that maybe down the road. If we go a little further down, we have a link or an area called Patients. This is where you can start typing one of your patient's names, and your patient, anybody that has a name close to that patient's name will come up. You can select it, and it's going to take you right to your patient chart. So there's your patient chart. That's one way to get to patients. The other way, which I failed to show you, is up here under the Patients tab. When we go to the Patients tab and we go to Patient Encounters, that's going to take us to all the patient records. CareFishing calls the patient chart the patient encounter. So if we click on Patient Encounters, it's going to take us to this screen. Now, this screen and what patients you see in here is going to be determined based on what agencies you're attached to. So right now I'm attached to all the agencies, but you can filter this. So let's say that you are only attached to VHO Hospice. Then only VHO will come up. But let's say you're attached to VHO Hospice and OHO Hospice, but you only want to be able to see VHO. You can filter that right here by the agency type. So here's all the different agencies in here. And you could just filter it by the agency.
Christy,
If
just
you want
really
to keep it filtered by...
Christy, really quickly,
Yeah.
just on that, if you could just click on the drop down on the agency type one more time. And so everyone, you will see Livingston Hospice Training. That is the agency that is sort of the sandbox. It allows you to go in and safely play with your patient. And the way your patient has been assigned is that the last name of the patient is your last name, and the first name is either Prince or Princess. So, so like right here, you could, well, what I'm like, so this first one here, who is that? That's me. Okay, so that's my practice patient, and my practice patient's first name is Princess, and the last name is Pavon. That is mine. I go into that. That is where I play and practice. That is where I enter, practice entering notes and orders and that sort of thing. So just stay in your lane with your patient, which is your last name and either Prince or Princess. Thank you, Christy.
You're welcome. And again, you do that by your agency, the third column. Now, if you want to save, lock it, excuse me, into one particular agency, let's say that I predominantly work for VHO, and that's who I want to automatically see when I come up versus having to filter by agency. You can put your agency in here, and then if you go clear to the right, there's a little lock. If you click on that lock, then when you come in here next time, it will just bring you right to VHO, to those patients. It doesn't mean you can't get to the other patients. You still can. It's just going to bring you to the one that you predominantly work with all the time. Okay? If you're looking for a patient and you don't see them on the list, you can also go to the third from the right where it says status. The status that automatically pops up is active, hold, and pending. But if your patient has been discharged, you can either look at discharge and bereavement, or you can look at them separately. So here's a bereavement, here's a discharge. Because the system will allow you to discharge a patient even if your documentation isn't done and all the orders are not in. So that you can, let's say your patient was admitted today or yesterday and died today, and so they discharged the patient in the system so we can start the bereavement period. You still can go in and do all your documentation and anything that needs to be done. The system will continue to remind you to do it. It won't let you forget if you have orders that need to be signed or anything like that. But they will be if you're looking for them under a discharge status or a bereavement status. The third way to get to patient charts, I'm going to go back to my home page so I could go to my calendar. For clinicians, the easiest way to get to your patient charts is just if the patient is on your calendar, you're just going to click on the patient's name. When you do, this box opens, and right here next to the bottom is View Patient Encounter. And that takes you right into their chart versus your list of patients. So now that we're in this patient record, let's talk a little bit about the record. This piece up here at the top we call the header. And in the header, you'll have your patient name. You'll have different links here, and these links will change based on where the patient is in their status during hospice. So don't get stressed out if these change. You'll have your patient phone number. If you hover over the little notebook, it'll also show you their address. You'll have your primary physician in here. If I had an address in here for him, because this is my test physician, you would have a little notebook there as well where you would have his address. This would show his phone number. Some of the items will not populate here until you do your start of care. So you're going to answer them during your start of care, and they're going to flow to the header, such as your patient allergies, your primary diagnosis, your disaster level. That's all going to flow when you guys do your starts of care. On the right-hand side, of course, is your date of birth, is the patient's date of birth, patient's age, and you'll see that this patient is in an active status. So our different statuses are pending, active, discharged, bereaved. We go a little further down. Our chart is set up similar to the old paper charts where you have tabs. Our first tab is our profile tab. On the profile tab, it's pretty self-explanatory. On the left-hand side is your patient's name, date of birth, age, gender, race, etc. If you guys do take patient Social Security numbers, then what you'll see here, and let me go put one in. What you'll see on your profile page is just what we call hashtags in this day. And that's not because you didn't get it in. It's because we don't want somebody that may be looking over your shoulder as you're logging in to be able to see somebody's Social Security number. So if you click on the edit button, it'll let you see the social. So it just hides it from that initial view. On the right side of the profile tab, gives you your start of care date, your patient's address, your referral source, and you have a place here for DNR. Now, if the intake team has the DNR status when they're activating the patient, they can put the DNR in. If not, it may be you guys or it may be the social worker or chaplain that's actually getting that information. To put that information in the system, you're just going to come to this profile tab under the current encounter and click edit, and here's your DNR status. You could also put in an advanced directives narrative. So let's say this patient is a do not resuscitate, but they have advanced directives that say, okay for antibiotics. Your DNR will come up here to your header, and your advanced directives are right here. Okay, your next tab is your contacts tab. Again, pretty self-explanatory. On the left-hand side is your patient contact information as far as their address, their phone number. You can add as many phone numbers as you need to. So you may have home phones, you may have cell phones. You can add more than one. Any phone number that is checked means that that is their primary number. On the right side of the screen is the patient contact information. You can put as many contacts in here as you want. The important thing to know is that they can be as many of these contact types that pertain. So it might be the patient's primary caregiver, that's also their emergency contact, that's also going to be followed in bereavement. What's really important is that if they are going to be followed in bereavement, that bereavement is checked, because this is what's going to tell the system to generate the bereavement letters. Your notes, next tab is your notes tab. This is not your visit notes. So we're going to be talking about, as time goes on, and trying to merge your processes with our processes, what you're going to be using this notes tab for. A couple of the things that we know for sure that you're going to use it for is there's going to be a night triage note. That's where if the night triage person gets a phone call, they're going to put their note in there. The other one that we know of is a telephone note. So this would be telephone notes such as that you call the patient to let them know that you're going to be there Tuesday at 8 o'clock. And then you'll find out more about what you guys might be using that notes tab for at a later time. Your next tab is your referral tab. Not a lot you have to worry about that. The next one is your physician tab. If your patient has more than one physician, you'll see them on here. So you may have your medical director, and you may have an attending physician. Under your documents tab, there's two sections. Now, most likely you guys aren't going to be uploading documents because you probably don't have a scanner out in the field. But if you were to upload a document, this is where you do it down here. This is typically for documents like paper consents because there's other places to upload for other things. So for instance, if your agency does photos of wounds, you'll be able to upload the photo to the actual visit note. So this is just if it didn't have another place to go. The top piece up here where it says forms, these are our electronic forms. So if you click on add form, what you'll see in here when you hit this drop down is a whole list of different electronic forms that we have in here. Now what I've done for hospice is I've filtered the hospice ones, the hospice admission ones towards the top. So that you could find them. So it'd be easier to find. So here's your hospice admission service agreement, your EOB. This is that patient notification of hospice of non-covered services. If in fact on their EOB they say they want that, your patient rights. So you guys may have more things that will end up in here based on what all you do in your admission pack, but that's basically what that is. The other things that I know for sure that you're going to use in here is your incident report and your infection control form. And the reason you'll be using those two is because that way it'll run your QAPI reports for infections and for falls or incidences. You also have your revocation form in here. You have a report of a concern in here, and then we have a triage form. So let's just open up the hospice admission service agreement so we can look at it. When I add it, it just brings it up as an electronic document. You just fill it out as appropriately, as you normally would. Then when you're completely done and you're ready for them to sign, you're just going to click on this Apply Signatures. The Apply Signatures is going to lock down whatever information that has been typed in here by you or the patient. Then you can click on Patient Responsible Party Signature. So this is where the patient, family, DPOA is signing. They can sign with a mouse, a stylus, their finger, whatever works on your device. Then you'll click on Agency Representative Signature, which is you, if you're the one getting consents, and it's going to put your electronic signature in there, and all you'll have to do is hit Accept. Now that that's complete, you can go clear to the top and hit the Complete button. And the Complete button just locks it down. So you can't get back in and change it. And that's your Documents tab. You have a Clinical tab, which is kind of a catch-all. There's some things that the Clinical tab will do that really don't have to do with you guys, so I'm going to not go into those with you, more from a scheduling aspect. The next tab is your medications tab, which we're going to talk about at length. Your orders tab, which we're going to talk about at length because those are going to be your guys' main tabs as nurses. The next one is your payers tab. And then your service note tab. And your service note tab is your visit notes. That's where your visit notes will sit. Okay, that's kind of the layout of the chart. So I'm going to take me back to my home page. I'm logged in as clinical trainer. I'm in here as multiple disciplines, which is why you see so much on my calendar. But today I'm going to be an RN. So I'm going to say today is the 2nd of March, and Sally Test is my patient that I have to admit. If you hover over Sally's name, it shows you what kind of visit it is. So this tells me that it is a hospice RN. Come on. Sometimes if you're in an area with low internet, your hover over doesn't work as well. So you can also click on this show service description up here, which will show you what type of visit. So it's a hospice RN, now it works, admit visit. So that's my visit type. So I get to Sally's house and I want to open my visit note so that I can document as I go. Now when I say document as I go, I do know that most of the time as nurses, we don't document everything at the bedside. But I want it open so I can document those things I'm not going to remember, like vital signs. So to do that, I'm just going to click on that visit. This box is going to open. Now this is the box that we had you go to the patient encounter to get to your patient chart. So the other thing that I want you to think about in this box right now is just that, view patient encounter, that gets you to their patient record. Or this one, which is what we're going to do to attach or open our note for this visit. So if you look for the green plus, it says add paged service note assessment. And that's just a lot of verbiage that says you're adding your documentation note. I'm just going to click on that. It's going to ask me if this is a regular assessment, meaning you're going to document electronically, or if you're going to be uploading your visit because you did it on paper. So we're just going to click on regular. It takes us and reminds us what type of visit we're doing. We're doing an admission visit, and it asks us what type of note we want to attach. Well, of course, since we're doing an admission visit, we want our admission note. So when you click in here, you're going to see the Hospice RN admission/HIS. And then you just click continue, and it's going to open your note. All of your notes, regardless of your discipline, and let me back up. All of your notes, regardless of what note type or what visit type you're doing, are all going to open up the same way. So they're all going to have these different tabs at the top. So the first one is a service note tab. Then you have the orders tab, which is going away, so don't worry about it. Then you have a medications tab, which is exactly the same tab of your medications in the patient chart. You have an orders and care needs tab, which is exactly the same tab as your orders tab inside the patient chart. So that's what you're going to start out with. If we go a little further down, we have a place here that says change section. This allows you to jump around your note. So let's say you walk into your patient home, and typically as nurses, we do head-to-toe assessments. But when you walk in, as especially a hospice nurse, you are assessing the minute you walk in the door. You're looking at their skin color. You're assessing whether they're in distress, whether they're in pain. So you can jump to any section you want. So let's say that I note as I'm walking through the door that this patient is having significant shortness of breath. I can just click on this change section, and I can jump right to the respiratory section. And I can document on the respiratory section. So that's what this change section is for you to be able to jump around your entire note. Each of these things that are here are sections in the note. Most sections are set up based on system. Okay, then when you go over here to the right-hand side, you've got the next button. Of course, that's just going to take you page by page through the note, and then we'll talk about the save, close, and the complete. Back over to the left-hand side, a little bit under your change section, you have a section here that says View Other Notes/Assessments. If there were other visits documented or done on this patient, they would be listed here. And when we look at a routine visit next time we meet, I'll show you that, how we can open up this admission visit to look at it without getting out of our note. We scroll down a little further. This is our service note header and supplies area. Gives us the date of your visit, the type of note you chose, your patient name, their medical record number, their date of birth, gives you a time in and a time out, your name and your discipline, and then travel duration, travel miles, and an area down here for patient signature. The only thing we're going to talk about right now is just the time in, because I just got there, and that's all I know right now is my time in. So I'm going to go ahead and put the time in, and then I've got to come up here to the top right corner and click Next. When I click Next, the very next page for me is the diagnosis. So for you guys, oftentimes you're being sent out to see a patient, and then the physician that made the referral is saying, admit this patient to hospice for COPD. But you get out there and you find out that actually they qualify better for CHF or for Alzheimer's or whatever. You guys are going to put in a diagnosis here, but the coding team is going to review the diagnoses that you're putting in. They'll add the comorbids, the secondaries, all of the additional diagnosis, and they may change that primary based on documentation that they're seeing. So go ahead and put in what you think the diagnosis should be, and then they'll take it from there. So again, and I did that too quick, I apologize. If you want to put a diagnosis in, you're just going to start typing whatever that diagnosis is, unless you happen to be one of those really good people who knows the ICD-10s, which is not me. Whoops, where to thrive? Because I know this one's in here, isn't it? There it is. And they'll pull up the diagnoses for you. Okay, when you're done there, we're just going to go next. And what I'm going to do here is I'm not going to focus on every piece of the note, but I'm going to talk about a couple of pieces in the note as we go through. So hang with me. I know this part is pretty self-explanatory because you can read the note, but there's a few things I want you to know. So first of all, as you'll notice, your HIS questions are integrated throughout your admission assessment. So it's not a separate document. They're integrated in your comprehensive assessment. And then the system is going to pull those HIS questions together to create your HIS document. All of those HIS questions are required. So if you don't answer one, the system's not going to let you close your note. It'll tell you which one you didn't answer. It'll give you a link to go answer it. There's going to be a couple of other things that are required, so otherwise you won't be able to close your note. One of them is this patient, family, caregiver able to provide care. And the reason that that is going to be that way is because it is a common deficiency. And so we want to make sure that you get that one answered. Again, you'll continue to see HIS questions. Okay, we'll go next. Then it's going to take you to your vital signs. And then your pain assessment. So for your pain assessment, of course, you have your HIS questions. You've got your comprehensive pain assessment. You have your pain rating and your patient's acceptable. You'll have what type of tool you use. If you need a pain at assessment, you'll have that in here. If you need a FLAC assessment, you'll have that in here. So if you don't need those, you're just going to skip those pieces. On sensory, we do have the ability for you to say within normal limits. But all the other systems do not. So this is your patient. Is your patient anxious? So this is your neuro. Your mental status. Anything that has a locator item is going to flow to the care plan. So you want to make sure you fill those out. Your respiratory, again, your HIST questions with your comprehensive assessment questions. You'll notice each system has a respiratory education with some things you can check off. Not that you can't also document other education. And then each section will have who the education was provided to, how it was provided, oral, written, or demonstrated, and who it was provided to. Cardiovascular. GI. Nutritional. Endocrine. So if you get to endocrine and the question is patient a diabetic, you say no, you can just, of course, skip the rest. Then we get to GU. ADL assessment. Musculoskeletal assessment. Your PPS. Another locator item, so these are their functional limitations. And then activities permitted. And I know as you're watching this, this seems like a lot, but as you get used to using the system, you know exactly what's here. So you're not having to hunt for it. The first time you do an admission is going to take you a lot longer than it is the 10th time you do an admission because you know where that information is at. Okay, so something a little different for integumentary. When we get to the integumentary assessment, we have just a standard integumentary assessment. But let's say your patient does have a wound. Let's say you marked wounds and they do have a wound. You go to next to this apply on demand section. So if you look in your upper right-hand corner, right under preview service notes, apply on demand section. And basically what that is it's going to bring up different things that you can add to your note on the fly. So they're not always in your note because they don't pertain to every patient. They only pertain to some of them. So if we scroll down to the bottom, here's all our different wounds. So let's say this patient has a pressure ulcer. We're just going to select pressure ulcer, number 1, and click Save. What that's doing is the system is adding that documentation for you to document on into your note. Because it's adding it, it took you back to the beginning of your note. So what you need to do then is just change section and go back to your integumentary assessment. And what you'll see is there's your integumentary, and now there's a pressure ulcer after it, whereas it wasn't there before. So this is your documentation for your pressure ulcer. Now, if you do add wounds, let's say, for instance, on admission you add, or whenever, it doesn't matter whether it's an admission or a routine visit. Let's say you add a pressure ulcer and you add a venous ulcer. Then next time when you go out or the LVN goes out or another RN goes out to do a visit, these two wounds, because the patient already had them, are going to automatically show up in your note until they're healed and you end them. So you won't have to add them again. That way, not only do you not have to end them again, but your choosing the same type of wound, because sometimes it's hard to tell what type of wound it is, and that way you're keeping your wounds labeled the same from a survey aspect. Next, you're going to have your Edmonton assessment, your Edmonton symptom assessment, your home safety assessment, which you should do on everyone. And then let me go look at this oxygen assessment. Sorry, that did have a mini oxygen on it. Let me see what this one looks like. Because I think we're only going to have the oxygen assessment as an apply on demand, because not all your patients are on oxygen. And it will be available to you as an apply on demand for all your visits, because maybe your patient doesn't have oxygen to start with. Where did it land itself? I must not have got it checked. But they may have oxygen later. Here's another locator item, your safety measures. That flows to your care plan. Here's your disaster level. You guys actually just have 3, so I'll be removing this number 4. LCDs, I'm not sure if you guys are using LCDs or not, so I'm going to leave that alone for right now. If you are going to use them, they're under the apply on demand, but we'll keep you posted on that and let you know at a later time. Next, we have a hospice actively dying on the initial assessment. So this is if you're going to admit your patient and your patient is actively dying. This gives you the ability to document towards what you're doing for that actively dying patient, because oftentimes you don't have time to get that full head-to-toe assessment done, along with supporting your patient and family symptomatically and emotionally. So this is just a place that if your patient is actively dying, you've got that documentation on admission. If not, you're just going to put NA. Next takes you to your allergies, which flows to multiple places in the system. And then we come to your medication evaluation. Now, when I get to my medication evaluation, this is when I always remember about my meds. When you're actually going out in the home, you guys as nurses, I know when I went out and did visits and my staff went out and did visits, every nurse does things a little bit differently. We each have kind of our own way and our own organization. Some people put their medications in first before they do anything else. It doesn't matter when you put your meds in. You can do it any time that fits into what your normal organization is. When you're going to put your medications in, you're going to click on this medications tab. And I'm going to show you how to put in medications. So once we get over to the medications tab, the meds that you are looking at in the home is the ones the patient gave you. So common scenario is you walk in the home and you ask the patient what medications they're on. They hand you a box. It may be that you're adding medications actually instead from a discharge summary from the hospital. Wherever you're adding your meds from, these are existing meds. So you're just going to click on Add Medication right here. And you're going to fill out the ones that are starred for sure. So those ones have to be filled out. The rest of it is just if you want your med profile in a status of having all the information on it. So if we say our entry type, this would be existing. Your options are existing, new, change, and discontinue. So we would take the existing because the patient's already on it. And we would just start typing and click enter. We're connected to a drug database called Lexicomp. So that's who provides all of this medication. So they're going to give you the medication, different names of aspirin, the different forms it comes in, the different dosages it comes in, and the different routes. So you're just going to choose the appropriate one for this patient. It's going to fill in that dose for you. And then you're going to have to fill in the patient dose and frequency. I'm going to put 1 tab daily. It automatically filled in the route for you. If you need to change the route, you can. And you're going to give it a start date. Now, the rest of this, again, is just if you want this on your med profile. So the type would be, is it over-the-counter, prescription, alternative, what is it? Who was it prescribed by? Who's administering? Now, if you don't fill this out, I do have you covered on one of your, on the medication evaluation page, because that is a regulation. So you could document it there as well. Here's your pharmacy if you want to track what pharmacy the patient uses. This physician notified is as if there are 2 physicians on the case. So if you have the person who prescribed it or the attending, and then your medical director, you would be notifying your medical director as well. This approved by is only if you're taking a verbal order. So because you're just entering these medications, you don't need to do the approved by. Then is it hospice covered? This effective date, I'm just changing because I'm admitting my patient in the past, but that will be the date that you're putting it in the system. I'm going to save and add another one, and I am going to add a couple of meds here that we don't always see hospice patients, but I want you to be able to see something. So some of the information stays filled out for you for your next meds when you do the save and add. And let's say, whoops. Nope, I didn't take that order, so we'll say yes. And I want to add one more thing. So the next thing that I'm going to add, I want to talk about items that may not be in the drug database. So you know CMS says that you have to put on your med profile all your prescriptions, your over-the-counters, your homeopathics, your alternatives, experimental drugs, wound treatment, nutritional supplements, any kind of respiratory treatment. Essentially, if in doubt, put it on the med profile. But not all of that stuff is really considered medications when you're dealing with a drug database. So in that case, how do you add them? Here's an example. So oxygen, the drug database does not consider a drug, which as nurses we know differently. But when you add oxygen and you click enter, you're going to get oxycodones and all of those things, but you're not going to get oxygen. So you're just not going to select anything. You're just going to click out of it and leave your oxygen. Then you're going to put your dosage, and then the patient's dosage and frequency. You'll come down and put in your route, and then just fill out the rest of your information. Is it covered? Yes. And save and close. And this is what happens when you try to put in something that's not in the drug database. You get a message that says the medication you entered cannot be found in the medication database. Click here to add an unknown medication to the encounter. So yes, you do want to add it to the med profile, so we do need to click there. However, when I click there, it gives me a second warning. And I don't know about you guys, but as a nurse, when I get a second warning, I take a second to look at it a little closer. And what this says is adding this medication will disable warnings and interaction information. And all that means is that it's not going to compare the oxygen to the Lortab or to the coumadin. All of your other meds will be checked for everything that the system's supposed to check for. It just can't check for the oxygen, which is fine. We know that. That's okay. We're going to save and close. When we save and close, it brings all of our medications here so we can look at them. And we want to first go ahead and add our our medication kit or your e-kit or comfort kit, whatever term you guys use. To add a medication kit, it's your second green plus. You click on Add Medication Kits. Your different medication kits will come up. So if you look here at the top, it says Medication Kit, and you have different ones. So you have your home hospice, your RCFE, SNF, and GIP. So you're just going to select the appropriate one for the patient. And this is your standard comfort kit or e-kit. If there's something that you aren't going to use, so because I already put oxygen on there, I'll go ahead and unclick oxygen. If there's something that you aren't going to use for this particular patient, you can unclick it. Or let's say there's something that you need to change. Let's say this patient is narcotic naive. And so when you start their Roxanol, you want to start it at every 2 hours as needed for the initial 0.25. You can change anything in here that needs to be changed. So you get that done. It's already said that your entry type is new because it is. You're going to put in your start date, who prescribed it, who's administering, what pharmacy, physician notified if we do need to notify one, and approved by is going to be you because you either took this as a verbal or you have it as a standing order. So you will be signing that order to send to the doc. And then, of course, is it hospice covered? Yes. And this date will automatically default to the correct date. That will add my medication kit to my med profile. And now when we look at the med profile, here's some different things that you can see. Up here at the top, we talked about adding meds. We talked about your med kit. The next one is you can print your medication profile. When you do print it, if you're going to, it's going to ask you what you want included. So do you want the drug interactions included? Do you want inactive medications? Do you want the classifications? Pharmacy address, physician. That's all depending on who you are printing it for. The next one we're going to come back to, this approved medication profile, and then you can also fax the medication profile. Now, when we come down here under the second column where it says alerts, if you click on the yellow triangle, it'll give you the alerts for the medication in a PDF document. If you click on the orange star, it gives you the allergy class and the food interactions. If you go clear to the right and hover over the drop-down arrow, it'll give you side effects, pharmacological information, patient education in English, and patient education in Spanish. This manage hold history, this would be if you had a medication, which is not real common in hospice. One of them that you guys would see maybe be on hold is coumadin if they're actually doing labs and somebody's managing their coumadin. And so what you could do is put that on hold. So if you hover over it, you can click on Manage Hold. What day do we want to start the hold on the coumadin? And if we know an end date, we could go ahead and put that in. If you don't know an end date, you can come back to that. And that's if you're just wanting to put a medication on hold because you think you're going to be reactivating it. Sorry, my screen's getting happy, isn't it? Then if you scroll down just a little bit, you have a section here called a drug-to-drug interaction. This is where the system runs the drug-to-drug interaction for you. If you hover over this little piece of paper, come on, hover, it will give you the pharmacological. Sorry, my internet is running slow. It'll give you the pharmacological reason for the drug-to-drug interaction. In the first column, you can see the severity. Now, everybody should have their own policy on what severity level that you call to the physician. Most agencies have that you only call the major severity level, but you'd want to make sure with your leadership what your policy is. So basically, CMS says that as nurses, that once we get the medications in, that we need to check the medications for drug interactions, duplicate drug therapy, ineffective drug therapy, side effects, all of that information. Well, the system has done that for you. But even though the system has done that for you, a surveyor wants to know that you noted it and that you did notify the physician if, in fact, the interactions were at the level of your policy. So to document that, we're going to click on this Approve Medication Profile. When I click on Approve Medication Profile, it brings this up. And this verbiage comes right from the CMS regs. And basically it says that you certified that you reviewed and documented all patient medications per your agency policy and have notified the physician of potential adverse effects, significant drug interactions, duplicate and ineffective drug therapy, and potential contraindications. So let's say that your physician, that in fact your patient did have major drug interactions. You can document here under comments, Dr. Dial notified of major drug interactions, ordered, or whatever your guys' verbiage is. Typically, your guys' verbiage is better than mine. But whatever your verbiage is, you can put it in there. And then you just click on this Enter Approval Signature. It's going to put your electronic signature on there, and you can save. And that covers you then when a surveyor is looking and wanting to know, did you do your med review and did you call your physician or notify your physician? So that's the med profile. We're going to talk more about the med profile when we go into day 2 of your training. So for now, I want to go back, because we're still talking about the admission, I want to go back to my service note, which is my visit note. So by the organization that I did mine in, now I'm ready to do my med eval. Now again, you guys may do it differently. You may put your meds in first and then start your head to toe. It's whatever works for you guys. So here again, can the family safely administer medications? That is a regulation, so that one will be required. It also flows to your plan of care. Who's going to be administering this? Of course, I put in here just in case you did not choose to select who is going to be administering under each medication. Your medication education provided. These are the things that they want you to provide on, so I will have that required. And then did you reconcile your meds? Yes or no? Then you have documentation for IV therapy. And then we go into your HIS questions for your opioids and your bowel regimen. We're going to go next. Next, what I have in here is called a Hospice Skilled Nurse Mini Spiritual Assessment. Now, the spiritual one's pretty simplistic, because the regs don't say what you have to have in here. But why this is here is because there's always that possibility, and we do see it frequently, that a family or a patient do not want either chaplain or social work services. And that's fine if they don't, but CMS guidelines say that you still have to do a full comprehensive assessment, which includes a spiritual and a psychosocial assessment. So this is covering you if your chaplain does not get in the door. The next page is covering you if your social worker doesn't get in the door, because that's a high deficiency. So that's what those two are for. The next page is your prognosis. Again, that flows to your plan of care. And then you have your narrative. Your narrative box does get as big as you need it to. Your narrative is, whatever you guys normally do for a narrative. Next, this is also a big deficiency, so that's why it's here. This shows that you collaborated with the medical director to develop the plan of care. And if there is an attending, that you collaborated with them as well. Next is your hospice coordination of care. So anytime you either create the plan of care, you change the plan of care, whether it be just a frequency change or a new medication or anything, you have to show that your family and patient are in agreement with that. And then who else might you have collaborated with? The very last thing is what's called IDT comments. So in our system, your IDT comments are going to flow to your IDT form. So in your old system, I believe, and in most systems, you have to go into the IDT form everybody does prior to IDT and get your notes documented. In CareFficient, everything between those 2 weeks of IDT will flow. So for your admission, what's going to go here is what you want to report in IDT. So it may be, in this case, very similar to your narrative. So some people may copy and paste their narrative, which is fine for that admission. It's also going to be in your routine visits, though. It's going to be in every single routine visit. So there may be routine visits that you go and you really don't have anything from that visit that needs to be reported in IDT, and you're going to leave that blank. But in some visits you may go and there's things that you need to report in IDT so you can discuss them, such as patient had a fall, or patient is now having increased pain or increased shortness of breath, or anything that you want to report, and that's going to flow so that it reminds you to talk about it in IDT, and it keeps it so that you don't have to log in and get into that IDT form right before IDT. So that's how the page ends. So let's say for our scenario that we're in the patient's home. We completed putting the medications in because we're looking at pill bottles out of a box. And we did our assessment and we filled out part of our documentation. We're going to fill out the rest of our documentation later. But we're getting ready to leave the patient home. You're going to go back up here to this change section. And you're going to go back to your very first page, which is your header and supplies. And the reason you're going back there is because, remember, you put your time in, but you haven't put your time out. And this is patient time is what this time is capturing. This doesn't have anything to do with what hours you're being paid. That's all a later discussion. This is just. Yes, ma'am?
Yes, ma'am.
Someone jump on? Okay. This is just your patient time, so it's going to calculate your patient time. So let's say you're timing out at 10:30. Yes, you're not done documenting, but you're leaving the patient home. Then you're going to come down here to this patient signature. The patient signature cannot be left blank. Or I'm sorry, it cannot be left at select. It has to be one of these choices. So electronic, if you do an electronic signature, you have the ability to get a link. You click on it, your patient, family, whoever can sign. If you're doing your signatures, either they're not required, you can select that. If they're on paper, whatever is your policy, but you can't leave it at selected. So once you've taken care of that, again, we're done in the home, but we're not done documenting. So because we're not done documenting, we're going to click on this Save and Close. That's going to allow us to get back into our note. So I'm just going to save and close. When I do, it takes me back to my home page. And now in my home page, let me get rid of my service notes so it's easier to see here. Now under my home page, as you see, here's my Sally test. There now is a little piece of paper to the left of the name. And if you hover over that paper, it says Open Service Note Exists. So essentially, what that means is that you've added your service note or you added your visit note, but it's still in an open status. You haven't locked it. You haven't completed it and locked it down. So you go ahead and go about the rest of your day. You get back to the office or back home or wherever, and you're ready to finish charting on Sally test. You log back into the system. When you log in, you're on your home page. You see Sally test on your calendar. You're just going to click on her name again. You'll notice this time when you click on her name, there's no green plus. And that's because you've already added your note. So you've already added that documentation. You're just not done with it. So this time you'll see an edit pencil, and it'll say Edit Paged Service Note Assessment. Essentially, that just means you're getting back into it so you can finish it. When you click on Edit, it's going to bring you right back into your note. you can go to this change section and go wherever it is that you need to finish documenting. When you do this drop down, and I'll show you this on our next meeting because I'm going to go in and finish your note, any section that you have done any documentation on is going to turn green. Now, you probably can't see that through the WebEx. I can see it, but it may not be as clear through WebEx. But so you'll know which ones at least you've done something on. But you're just going to jump to wherever you need to be and document on those. The other thing you're going to do while you're in here is you're going to go to your Orders and Care Needs tab. And this is the second part of your admission. So under your Orders and Care Needs tab, we're only going to talk about one piece of this today. We'll talk about the other piece tomorrow because I don't want to give you too much. I apologize. Hold on 1 minute. Okay. So what we're going to do is you're going to add your frequency orders for you and for your aide if an aide is actually going to be ordered. To do that, again, you're going to go to your Orders and Care Needs tab. The top section is Orders. Under your Orders, the very first thing under Type is Care Plan. We're going to get inside your care plan. So if you go, to the far right, you'll see an edit pencil. An edit pencil is going to let you inside your care plan. Now, when you click on that, you'll see your care plan. Now, one thing I do want to tell you, because some of us are type A's, if you're a type A, the first thing that you want to do as you're scrolling down is you want to start marking some of these. That's your feeling. It's like, oh, this is blank, I got to do it. But please know, do not mark anything on here because all of that is going to flow from your visit note. That's all going to be filled out when you turn your visit note in. So don't worry about any of that. Scroll clear down to where you see the 3 calendars. These 3 calendars and this left side do not show up on your plan of care when it's printed and sent for signature or when it's ready to be electronically signed or when your surveyor looks at it. This is just here for a visual for you. So you'll see this light blue one is the nurse. That was your admission. This pink one is the social worker's initial visit. And this dark blue is the chaplain's initial visit. So we're going to be doing skilled nurse frequencies. So you admitted your patient on a Tuesday. Most likely you're going to be doing another visit that week. CareFishent system schedules week by week. So right now it says skilled nurse 1 week 1. Well, in fact, we're going to be sticking another visit in here. So it's going to be skilled nurse 2 week 1. So you're just going to come down here and highlight under where it says orders, click to edit. You're just going to highlight that because we're dealing with that week. So when you highlight that and you scroll a little ways down, it shows you right now what's ordered or what's on the calendar, which is skilled nurse weekly on Tuesday, which is your admission. So you just want to go ahead and add your second date. And let's say you guys do a 24-hour follow-up or a 48-hour follow-up. You're going to go ahead and schedule your Wednesday. So you're going to admit that patient on Tuesday, see them for their follow-up on Wednesday, and you're going to do that for the first week. So you're just going to click Update because you want to change what was there to your new schedule. So there's my 2 visits. Now I want to go on to the next week. I'm just going to scroll down here again. It's going to give me my discipline of skilled nurse. If it doesn't, you just click on the drop-down because it'll give you all the different disciplines. It'll give you your frequency. Typically, nurses see patients on a weekly basis, but that may change based on the patient. So your options are weekly, monthly, daily, every, and PRN. So we're going to say weekly. And then what days are we going to see them? So let's say you're going to see this patient twice a week, and you think you're going to do Monday and Thursday. Just know that you only need to get the two times in here. It doesn't matter what day you put them on because you could move them on your calendar. So let's say you put them on Monday and Thursday because you thought those were the best days. And when you get to your calendar, you see you already have too many patients on Monday, Thursday. You don't have to come back and redo this. You can just click and move it on your calendar, and I'll show you that. So we're going to do skilled nurse on a weekly frequency of twice a week on Mondays and Thursdays for a duration of how long? If you click on this drop down, it'll give you the amount of weeks left in the benefit period. It will not let you schedule past the end of the benefit period. So I'm going to click on 13 because that's what it gives me, and click add. If by chance one of your days does not fit in your last week, the system's going to tell you. So it says days selected do not fit in the last week. So obviously the last week, Thursday doesn't fit, and potentially Monday. We'll just have to see. So what I'm going to do is I'm going to change my duration from 13 to 12. And it puts those in. And the last week, see, is only a Sunday. So that's why it didn't let me. Now I'm going to go ahead and put in my PRN visits. So again, you've got your discipline as skilled nurse. We're going to change your weekly to PRN. And you're going to put in your PRN amount. Now this PRN amount is for the entire benefit period. But remember, you cannot have more PRN visits than you have routine visits. And then we'll just click add. That will add your PRNs. You'll notice it placed all of your visits, but it's not placing your PRN visits because we don't know when you're going to do them. And I'll show you at our next meeting how to get to those. Okay, so we got the nurse routine visits done. We got the nurse PRN visits done. On this right-hand side down here where it says order description, click to edit, our skilled nurse is highlighted. When it's highlighted, when one of them is highlighted, this box down here is open. If it wasn't highlighted, this is what it would look like. So we want it highlighted so we can add in here. And we're going to add some of your quote standing orders. To do that, you're going to come click on this little blue, what looks like a Lego to me. When I click on the blue Lego, what I get is your standing orders, or what I call your standing orders. When you look at the second column where it says type, just filter that to skilled nurse. And then you can go through and pick your standing orders that would be appropriate for this patient. And it also gives you reason for your PRNs. And then just click Save. And it's going to put all those standing orders down here under the Edit Order Description. And you're just going to click this Update, and it's going to move those orders up underneath your skilled nurse. Next, we're going to do that same process for your aide. So you're going to go over here to Discipline, change it to HHA. HHA typically is weekly. So what days do we want the aide to go? It's possible that the aide won't get there, be able to start her visits until maybe she's going to do Wednesday, Friday for the first week. And she's going to do that for 1 week. And then after that, you want her to do opposite days of you, so she's going to do Tuesday, Friday. And we already know that only 12 weeks will fit in. And you know the aide does not get PRN visits, so we don't need to do any PRNs. We do need to make sure that the aide is highlighted, which it is, so we can click on this little Lego and go filter to aide and put in our aide order. Oops, sorry. Okay, so when you're completely done with your frequency and your aide frequency, and again, you can look at it, how does that look? Doesn't mean if you don't like how it looks that you have to change anything here. We can go change it on the calendar. You're now ready to scroll to the bottom. Again, don't worry about these boxes. They're going to be all filled out after your admission note is completed. Scroll down, and there's a box down at the bottom right-hand corner that says Schedule Discipline. You want to click that Schedule Discipline, because what that does is that's putting the visits on the patient's calendar. And if you don't click that, even though you've ordered them all, it's not going to put them on the calendar. Okay, so right now what we've done is we have started our admission documentation. We've added our medications. We've added our frequency orders. We saved and closed. Then we got back in by editing and doing some more documentation. And I'm just going to save and close this for now because I'm going to complete it so tomorrow when we meet, you can see where things flow. So do we have any questions?
Before you jump off that, Christy, can you go to the IDT note and remind staff that they need to put their discipline in first, SN or
Thank you, Tree. I forgot that. Yes. So for under your IDT comments, for right now, you want to put in your discipline, RN, SN, RN, whichever you want to use, prior to your comment. And that's so that it's easier to read in your IDT review because it'll separate you from the other disciplines. Eventually, the system will do that for you. They're working on that right now. So right now, please put in your discipline. Okay, thank you, Tree, very much. I forgot about that. Okay, other questions?
Can you show us how to do the PRN visits again? Because I can generate SN visits, but the PRN, it's graying out. It's not letting me add them.
Okay, so are you talking about when you're underneath the orders?
Yeah.
And you're in here? And I wonder if is it a patient that you're used? Sorry, go ahead.
It's my test person. So all the way down, I added regular visits, and now I want to add PRN visits, but it won't let me do it.
All right, let's go look at your test patient and see. Oh, some days my internet, I just want to scream. Okay, who's your test patient?
Wallace, Princess. WALLACE.
Under the training agency.
Oh, yeah, I should have kept them all up here, and I locked mine down. There we go. Can you save and close for me? That way I'll be able to get into it.
Yeah. Okay, it's done.
Thank you, ma'am. Okay, so let's go see what's going on. Okay, so is this where you're at?
Yes.
So you got your 1 week 1, 1 week 1, 2 week 8. Okay, so then you've got your skilled nurse here. And then under your frequency, you went to PRN.
Yeah, but it was grayed out. It wasn't letting me do that.
And let me go. I wonder if it's you should have the same security I do. So it wouldn't let you switch to PRN?
It wouldn't, but now it's working for you. So that's
okay,
good.
I'll check and make sure it's not a security, because you should have the same security that I do, because we have the same in clinical trainer. I should be. Go ahead.
Right. It didn't seem to mind when I added regular visits. So I don't know if I just maxed out my number of visits or frequency or what.
No, PRN.
Yeah, when you're adding,
you'll be able to add PRN. So if it's grayed out.
Right.
it's
When
a
you're adding your routine,
So we'll have to check.
All right, thank you.
so when you're adding routine visits, it'll hit a point that it's grayed out. But for PRNs, you should be able to add. So if you continue to have that problem, let us know and we'll help you with it.
Right, and the other thing I was just texting our main guy from about was under the documents. I don't have any documents for start of care or whatnot. I can't pull those up.
Okay, so that might be something I need to look at. I'm going to log into your system on my other screen just to make sure that you have the access you need.
I just have a question on the SM order. Can we customize it based on the diagnosis of our patient? Yeah, like, we have the standard order over there, like if it's kind of related with CHF or something like that. So can we customize the order text over there?
So what she's asking is when you're writing the nursing order and you go to the blue Lego and there are the standard orders that you can just check off. She's asking, can you,
Right.
For one, edit those, but also can you write something individualized for that patient that is not one of the check boxes under the little Lego?
Yes. So you can either edit whatever's there. So let's say for this particular patient that you've added the standing order for O2, but it's only 2 to 4. You can edit that. You can also, when you get to the bottom of your standing orders that you've just added, if you just hit return, you can add whatever orders you want. And then just click update. Did that answer your question?
Yes, ma'am. Thank you.
You're welcome.
I
Other
have a
questions?
question. Yes, I have a question about the wounds. Can you hear me okay?
Yes.
Okay. So, I'm wondering when a stage 1 pressure ulcer becomes a stage 3, how do we notify the system of that change? Do we have to discontinue a stage 1 and enter a stage 3?
So you're saying that your wound started, let me get back into the note. You're saying your wound started at a stage 1, but now it's a stage 3.
Correct.
Okay. So part of this would be based on your policy. Come on. Sorry, let me get in here because I'm a visual, so I apologize. Let me go to
No, that's
wound.
great. Thank you.
I'm such a visual. It's a hindrance sometimes. But okay, and let me see if I got one added.
Yeah, you do.
Oh. I must have removed it. Did I? Because I don't remember. Let me add a. So you're saying pressure ulcer 1. Okay. So, whoops. So this is started out as a 1. It's going to flow forward as wound 1, which started as a pressure ulcer, stage 1. When it flows forward, it's still going to flow forward as wound number 1, but if your staging changes, you're going to go ahead and change your staging here. So then your question was, how do you notify?
Well, basically what you're showing me,
Somebody-
how, is it easy enough to go into wound 1 and when it gets worse and becomes a stage 3, are we able to just update it? And it looks like, yes, we are able to just go in and update
Yes.
it and not have to rename it or anything.
Correct.
Okay.
And that's a really important point because so many of the things as a surveyor, I I'm really not one that likes to copy information forward, because so often I see agencies do that to a point of detriment, because they're going too fast and they don't go in and edit it. So yes, anything that's going to be able to be copied forward, and the wounds are going to be, because that way you'll know what they looked like last time. But you do want to edit it, whether it be in the measurements or any of these. You're just going to, you know, make it appropriate for your assessment.
So just to
Excellent.
clarify what she's saying, in revisits after this start of care, their wound 1 is going to show up in your revisit documentation, and it will show up, it's going to forward as a pressure ulcer 1. That's what you'll see. When you're doing your revisit, that's when you can go in and say, aha, it's a 3 now, and then you can click and change it to a 3. Then the next visit, wound number 1 is going to go forward as a pressure ulcer 3.
Okay.
Now I have a question. So does that notify like our
Yes.
wound specialists?
No,
How does that work? Because our other system did.
yeah, this system is different, and it does not notify the wound specialist. The wounds are a little more complicated on how you're going to do it, but you would be notifying them. We have to decide either one of 2 ways, either through your click or through the, but there's a way inside the system that to send messages back and forth.
Okay.
So we'll let you know.
Thank you.
And Tree, remind me remind me about that when we meet again, because there may be a way that we can, I can get them to do an enhancement where they would just click a button on here, a click mark on here that would create that communication.
Thank you.
I have a question, Christy.
So just,
So with the wound treatment order, do you fill that out in wound addendum or do you fill it out in orders? And does it flow to each other?
There is no wound addendum.
I mean, okay, sorry. In this part of the chart, or do you have to go to orders and put it there, or both?
it has to be in your orders per CMS. But I see what you're saying. But what your orders are is what your physician ordered. And I realize a lot of times the physician isn't making the decision. You guys are, but they're signing the order. What you're doing here is you're documenting that you followed that order. So if the order said to cleanse with wound spray, this isn't actually your order. This is what did I do, which is proving that you followed your order. Does that make sense?
It does. So then once you put it in orders though, does it flow to this part of the chart? So
It
you can
does not
see your
flow
order.
to this part of the chart.
You have to read your order so you know what your wound care is.
Okay, thank you.
Now, the last person that they document, when they document it, it's going to flow. So if they documented this incorrectly and it doesn't match your med profile and you don't change it, then you're documenting incorrectly. And that's what tends to be a bigger issue in home health than it does in hospice, but a lot of deficiencies surrounding the fact that the documentation of wound treatment doesn't follow the physician order. So this would be an important piece of it. Now, that Tree, remind me when we meet again, there's another possible option on that we can talk about.
Okay.
Anyone else?
Nothing
Okay,
here.
no one else has any other questions? We meet again tomorrow. What I'm going to do is I'm going to go in and I'm going to complete this documentation so that when we look at a routine visit, you can see how things flow. You can see, you know, where your HIS flows to. We will also be doing tomorrow the last step of your admission, which is going to be adding your care needs, interventions, and goals. And care needs are patient problems. Okay. Otherwise, have a great rest of your day. I know you're going out to see patients, so have a good, safe day.
Thank you.
Bye-bye.